That summer, students of the Department of Higher Nervous Activity of the Moscow State University are interning in psychophysiology. During theoretical and practical classes, students learn to registrate electroencephalogram, electroocculogram, and make polygraphic recordings. And of course, they are trained in the field of evoked and event-related potentials. Today, we invite you to join the students who are learning to record and analyze visual evoked potentials. Visual evoked potential is the electrical activity of the brain that occurs in response to visual stimuli. To record this electrical activity, electrodes are placed on the scalp. The electrodes are placed according to the international 10 to 20% system, and the recording is made either in a monopolar way, when the reference electrodes are placed on earlobes, or in a bipolar way. Both of these leads are used to record electrical signals in the brain. In the resulting EEG recording, stimulus presentation marks are simultaneously recorded with the electrical signals of the brain. Here, the presentation of the stimulus is indicated by the blue arrow. The blue square appears, inducing a change in electrical activity. The sensory phenomenon, the evoked response, which we are interested in, is masked by other electrical activity, and we are not able to see it on the recording. Why is this? The electrical signal that corresponds sensory information received to the brain is often very weak. In fact, it is weaker and lower in amplitude than any other electrical process that we can measure with scalp electrodes. Even the EEG typically achieves an amplitude of 100 microvolts in healthy subjects, but in pathology 200, 500 or higher. There may also be other noises that could be artifacts. The electroocculogram, the electromyogram, and the electrocardiogram amplitude level are much higher than the evoked potential signal that we need. So how could we detect it? To do this, the EEG recording is divided into parts or epochs of analysis. The start of each epoch is synchronized with the moment of sensory stimulus presentation, with the moment it is turned on. Then all these epochs are averaged. The samplings of amplitude of electrical activity in each of these epochs is averaged with the next and so on. After that, we can detect the sensory response, a visual evoked potential. Why does this happen? Let's look at three different epochs. The first, the second, and the third. The stimulus is turned on at the very beginning of this epoch of analysis. In this epoch of recording, we can see spontaneous rhythmic activity of the brain. It is a random process, unrelated to the stimulus in any way. And in each sample during each epoch, the values of amplitude can occur in the most random way. Somewhere they're negative, somewhere they're positive, and so when we average these values, we get something close to the zero line. Whereas the evoked response, the sensory response that occurs every time a sensory stimulus is presented, occurs absolutely stereotypically every time in every epoch of analysis. And as a result of the averaging, it does not change its amplitude. It remains at absolutely the same level. And as a result, after averaging, we get this combined response. A constant evoked potential and residual noise that we could not completely remove by averaging the epochs of analysis. The more epochs are averaged, the better is the signal-to-noise ratio. We change that ratio in favor of the evoked potential with the help of this method of synchronous averaging. We have the evoked potential amplitude at the same level all the time, and the noise amplitudes get lower and lower the more averages we use. In practice, the number of averaged epochs depends on the amplitude of the evoked potential signal. In this respect, the visual evoked potential is a very good signal because it is only 5 times smaller than the background electrical activity. Therefore, 100 averaged epochs will be sufficient for its detection. Although, of course, the more the better, as in fact is shown here. The examples on the right show fragments of an electroencephalogram recorded without stimulus presentation. It's just a spontaneous rhythmic activity. You can see what happens after 5 averages, 10, 15, 35, 100, and 200 averages. The signal gets smaller and smaller and less of it remains after averaging, while the evoked potentials shown on the left, on the contrary, are getting more and more distinguishable. You can see there is almost no difference between 100 and 200 averages. The signal stands out very well. Now let's talk about the visual stimuli that are used to record visual evoked potentials. They could be different depending on which studies are being conducted, clinical or psychophysiological. In clinical practice, flashes of light are most commonly used. Bright flashes generated by light-emitting diodes are applied rhythmically to closed eyes. Each of these flashes is in fact the sensory stimulus that causes the evoked potential to appear. Another way of clinical stimuli application involves the reversible checkerboard pattern. This stimulus looks like a checkerboard with rapid alternation of black and white squares. Accordingly, each time a change occurs, the epoch of analysis is marked, and all of them are averaged to detect sensory response. In psychophysiological studies, a variety of stimuli can be used for visual stimulation. If you're interested in features of visual perception, features of color distinction, and other characteristics, colored circles or squares can be used. In addition to various color stimuli, a range of visual stimuli, including photographs, drawings, words, and other symbols, depending on the specific interest of the researcher, could be used. The number of averages and the number of presentations of these stimuli are also determined by the objectives of the study. In psychophysiology, there may be a limited number of presentations. It could be around 50 or perhaps more. Typically, physiologists are more interested in later processes connected with the processing of information. However, in clinical practice, where earlier events are of interest and the whole structure of the evoked potential is more important, the number of presentations is much greater. It can range from 100 to more than 500, and the number of averaged epochs of analysis will correspondingly vary. What do typical visual evoked potentials look like? The following are two examples of visual evoked potentials. One is an evoked potential in response to a flash stimulus, the other is a response to a reverse checkerboard pattern. In the case of the visual evoked potential to a flash, it should be noted that its components could have a very large individual variability. Moreover, they depend on the conditions of stimulation, illumination, and of the flash intensity. So in this case, there may not be a stable response. On the other hand, in the case of the reverse checkerboard pattern, the recorded responses are much more stable and reproducible for each participant. In addition, with the help of checkerboard pattern, we are registering not a response to a change in brightness as we do with a flash. There is a flash, no flash, it's dark. There is a flash, no flash. Here, due to the presence of white-black squares, the detection of boundaries, contrast, spatial frequency takes place, and it's better for description of the state of visual system at specific functions. This method is widely used in clinical practice to study visual acuity and in fact specific visual functions. The topography of visual evoked potentials is quite typical. Everything is determined by the location of the projection sensory zones of the visual cortex. In this case, it is located in the upper part of the diagram with the nose facing downward. And it is well seen that all components of the VEP are best expressed in those leads that are closest to the area of sensory projection zones. As we move from the posterior pole to the anterior frontal pole, we can clearly see that the evoked potentials decrease in amplitude and are much less well detected. Let us delve into the mechanisms of visual evoked potential generation. It is important to note that the evoked potentials recorded with electrodes placed on the scalp are extremely weak electrical responses. These responses result from the summation of elementary electrical potentials, postsynaptic gradual potentials, both excitatory and inhibitory. The role of the action potentials is negligible in this case. Additionally, it is crucial to bear in mind that the electrode we're registering from is positioned above the surface of the cortex, above all the cerebral meninges and the skull. That is, it is quite far removed. It registers the activity of the structures that are located far away from it. And here the main role, a special role, is played by the so-called nerve centers. This is a group of neurons which are united structurally and spatially into a certain functional and morphological unit. These may be switching nuclei, through which information enters when it goes through the visual sensory system. It can be the reticular formation of the brainstem, which includes a huge number of neurons. It's a whole network of neurons. These structures could be basal ganglia, or they could be functionally and cytoarchitecturally specialized areas of the cerebral cortex. These are large groups of neurons that change their activity, and we register it with an electrode located on the skin surface. And ideally, if everything were so simple, we would get this simple potential: biphasic, negative, positive. However, as the information that has entered the visual sensory system is transmitted through all the pathways, through all the switches, there is a divergence of information. Some of the information takes a very short path with a small number of switches and reaches the cortex the fastest, and we register the deviation of potential with an electrode located on the skin surface. But that's not all. At the same time, another part of the afferent information travels along a path with more switches and also reaches the area where we register the activity. Finally, there is a third part that involves a great number of switches. This path goes through the reticular formation, through the limbic systems of the brain. It also reaches the corresponding electrode, which we use to register the activity. As a result, instead of a simple response, we get a rather complex, multi-component evoked potential. It is logical that these very early components, which have a short latency and small amplitude, are associated with the arrival of information along a path with a small number of switches, the fastest path to reach the corresponding projection zone. Those that appear later have a large amplitude. They are associated with the arrival of information on paths with a large number of switches. And their amplitude is large because many neurons change their activity, give their response, and we see this in the form of larger amplitude of each component. If we look at the components with different latencies, those with a latency of up to 15 milliseconds are associated with extracortical or even extracerebral sources. Those with a latency of up to 20 milliseconds are associated with excitation of thalamic relay nuclei and thalamocortical radiation. From 20 to 40 reflect afferent influx through the rapid conduction system. From 40 to 100 are reflected the afferent inflow through the lemniscal pathways, the striatal complex, and the associative nuclei of the thalamus. Finally, the components with a latency of more than 100 milliseconds are connected with a nonspecific afferent inflow from the reticular nuclei of the thalamus, from various parts of the temporal and frontal cortex, and finally from structures of the reticular limbic complex. If we look at the structure of the visual EP, those components that reflect the arrival of specific sensory information and occur with a latency of up to 100 milliseconds are called early components. Those associated with later, nonspecific inflow have a latency of more than 100 milliseconds and are called late components. What happens during the period when early and late components are formed? According to the hypothesis of information synthesis, developed by Alexei Ivanitsky, The arrival of information to the projection zone occurs quite speedily, but the process does not stop there, and a cyclic movement of nerve impulses through various cortical lobes takes place. As you can see, both temporal and frontal lobes are involved, and as a result of this cyclic movement, as well as the synthesis of sensory information with information extracted from memory, a sensation is formed. It not only conveys the physical properties of the stimulus that first entered the projection zone, but can also be emotionally colored. So in the visually evoked potential, we could identify early specific components. These components have a latency of up to 100 milliseconds. They may be N75, P100, or perhaps even earlier components identified as P60. The early components are related to differences in the physical parameters of the stimulus. It could be brightness, color, contrast, or a number of contrast boundaries. Now let's look at the later components of the visual evoked potential. In contrast to the early ones, which we have already discussed, they are not related to the arrival of the sensory information itself, but to a more complex processing of it. Therefore, they depend on the functional activity of the brain. They depend on the level of attention, the emotional background, and the subjective significance of the stimuli for the participant. So, what can we conclude about the structure of visual evoked potential? The first 100 milliseconds correspond to the arrival of visual sensory information. During these milliseconds, the early components are formed. Later, more complex processing occurs, and late components are formed that are more related to the participant's functional state, subjective attitude towards stimuli, and emotional response. Finally, after the late components, somewhere between 250 and 300 milliseconds, a so-called rhythmic afteractivity is formed. These are alpha-like, spindle-shaped oscillations associated with the background electroencephalogram and with the activity of specific and non-specific thalamic nuclei. They are typical for visual evoked potentials when the presentation of stimuli is divided by an interstimulus interval. The rhythmic afteractivity is best expressed in the projection zones, that is, in the O1-O2 leads, which are located above the occipital cortex. The method of visual evoked potentials recording is widely used in clinical research, in psychophysiological studies, in brain-computer interfaces where the late components of visual evoked potentials are more common, and in forensic medicine. Let us take a closer look at the clinical use of visual evoked potentials. As mentioned earlier, two types of stimulation are used in clinical practice. These are the reverse checkerboard pattern and flashes. Both methods are well suited to assess the condition of different levels of the visual sensory system, including its peripheral part, conducting pathways, and the visual cortex. As with flash-evoked potentials, this method is used for visual field assessment and general visual function testing. The main advantage of this method is that it can be used in patients with low visual acuity, when vision cannot be compensated, as well as in cases of refractive errors and visual fixation disorders. For example, when working with infants and newborns, or patients with altered states of consciousness. This slide shows examples of visual evoked potentials in newborns. You can clearly see how amplitude and latency change with the development of the visual system. There are also examples of visual evoked potentials in the normal state and in the coma state. It is clearly seen that in the coma state, the rhythmic afteractivity disappears. The component structure of the evoked potential changes up to the complete absence of visual evoked potentials. The registration of flash VEPs is a good way to detect disorders that occur at different levels of the visual system. For this purpose, it is necessary to keep in mind the peculiarities of information conduction from the retina and to remember that information from different parts of the retina goes to different hemispheres, including contralateral through the chiasma. Thus, in order to diagnose various disorders more accurately using the method of visual evoked potentials, it is best to perform the stimulation monocularly, given flash stimuli to one eye. For this purpose, a special patch is used to cover one of the patient's eyes, and stimuli are presented so that they are selectively perceived by another eye. In this case, the light coming to the retina affects both hemispheres. Whatever comes from the nasal part of the visual field is projected onto the temporal part of the retina, and the information goes ipsilaterally to the corresponding hemisphere. The part of the light that comes from the temporal part of the visual field is projected onto the nasal part of the retina, and nerve impulses passes through the chiasma to the other hemisphere. The registration electrodes are positioned in leads 01 and 02. This allows the assessment of the intensity of the response in each hemisphere. Let's look at some examples. What happens to the visual evoked potentials when the optic nerve is damaged? In this case, we can see recorded evoked potentials in a patient with a lesion of the right optic nerve. In this instance, there will be complete blindness in one eye. The person will not see anything with the right eye. In the visual evoked potentials, this will be manifested as follows. When stimuli are presented monocularly to the left eye, visual evoked potentials are recorded in both the right and left hemispheres. This is due to the absence of issues with the conduction of sensory information. From the left eye, all information will be transmitted to both hemispheres. In the same case, when stimulation is given to the other eye, the right eye, where there is complete nerve damage, there will be no visual evoked potentials in either hemisphere. What will happen to this patient's visual fields? These are the visual fields of the right and left eyes of a healthy subject. It's not a full sphere or a full circle, but a certain part of it with a wider temporal part of the field of vision. And what will happen to the patient in this case? Due to the loss of visual information from the right eye, the visual field of the right eye will be completely absent. That is, complete blindness. The person will not see anything with the right eye. If the disorder is less severe, for instance, is associated with demyelination, the transmission of visual information and afferent information slows down, and visual evoked potentials components will have a greater latency. For example, here the red line indicates the visual evoked potentials obtained by stimulating the eye, from which the information travels along the demyelinated nerve. Also, the potential amplitude is smaller. In this case, the patient does not experience complete vision loss. He reports a decrease in visual acuity and a partial loss of vision. This loss is not connected to the peripheral boundaries and appears as a darkening in the field of vision. In such a case, the flash stimulus is not the best one for testing the state of the visual sensory system and visual functions. The checkerboard pattern is more effective because it has contrasting borders, which make local dropouts easier to detect. In this scenario, checkerboard squares are displayed on the screen in alternation. Likewise, the evoked potentials in the occipital leads are recorded. The responses obtained are used to detect disorders based on the difference between the right and left eyes, as shown here. When stimulating the right eye where there is no problems, we see all the components with marks corresponding to their peak latency. And what happens when stimulating the left eye where there is pronounced demyelination of the left nerve? As you can see, there are evoked responses, but they're shifted in latency and have a smaller amplitude. Another example, damage to the optic tract and optic radiation. These levels of the visual system are shown here. In this region, fibers gather after the chiasma and after the crossing, and then proceed to one hemisphere. What happens to the visual evoked potentials in this case? If stimulation is carried out monocularly, evoked potentials will invariably be absent in the hemisphere with damage to the optic tract and optic radiation, and it would not depend on the eye we stimulate. In this example, there will be no evoked responses in the left hemisphere of the brain if the damage is on the left side. In the right hemisphere, visual responses are recorded when either eye is stimulated, because nerve impulses are transmitted along the pathways without any disruptions, and no responses in the left hemisphere. What do patients complain about in this case? Let's examine which parts of the visual field the information originates from. For the right eye, it comes from the temporal half of the visual field, and for the left eye, it comes from the nasal part of the visual field. The visual fields of a healthy person are shown here. In the case of the patient, there will be a loss of visual fields on one side. It would be the right hemifields. This phenomenon is known as hemianopsia, a loss of half of the visual field. In this case, we're dealing with homonymous hemianopsia. The homonymous half fields of vision fall out. In this case, the right half fields of vision are absent. And the person perceives the following. He's able to see the left side, but he's unable to see the right side of his visual field. This is very well identified by the evoked potentials analysis. Therefore, it is possible to identify disorders manifested at different levels of the visual system. It should be noted that the method of visual evoked potentials is highly effective for differentiation of organic and functional illness. For instance, this tool allows to divide organic blindness from various psychogenic disorders associated, for example, with hysteria. Here is an example of a patient with psychogenic blindness. While visual evoked potentials are completely absent in true organic blindness, they are recorded in psychogenic disorders, and they vary according to the conditions of stimulation. As an example, A. These are VEPs to the flashes presented to open and closed eyes. These are VEPs obtained in different series at the presentation of the word house and two vertical lines. You can see that these evoked potentials are different from each other and from the flash evoked potential. And here are the evoked potentials obtained at the presentation of stimuli of red and blue color. As you can see, the response takes place. It is different depending on the type of stimulus presented. This indicates that the disorder is not organic but functional and psychogenic in nature. This completes the theoretical part, and we will move on to practical tasks for mastering the method of visual evoked potentials registration. The setup for visual evoked potentials recording is not difficult to assemble. It could be arranged right in the classroom. The system includes an NVX biopotential amplifier to which the STIM unit is connected. This unit provides synchronization of all recorded signals. The amplifier and the STIM unit are connected to a personal computer via several USB cables. When recording visual evoked potentials, the VGA Sense photometric sensor is also required to record the exact time of visual stimuli appearance. To record evoked potentials to flash stimuli, we need a photostimulator that has to be connected to a personal computer and synchronized with other devices. Let's look how our students cope with the task. When recording visual evoked potentials, different numbers of electrodes and different types of electrode montage could be used. If it is necessary to install a large number of electrodes and carry out multi-channel recording, it is better to use a textile cap with pre-installed electrodes according to the 10-20% system. We use textile caps with rings and removable electrodes, which allow students to master all the rules of electrode placement and recording of evoked potentials better. If the number of electrodes to be applied is small, for example in the case of bipolar two-channel registration in leads O1FZ and O2FZ, it's not necessary to use a textile cap. It is possible to take silver chloride cup electrodes and apply them with adhesive electrode paste to the treated surface of the scalp. During the internship, students work in small groups. This allows them to gain real practical skills. Each group performs its own task and submits a report. Now we're gonna join one of the groups that will be registering flash evoked potentials. The flash scenario is located in the Neurovisor EP module. This test shows how the physical characteristics of the stimulus affect the parameters of the early and late components of the visual evoked potentials. The scenario settings allow you to adjust the stimulus intensity by changing the flash brightness in percentages from 1 to 100. Let's start with the minimum brightness. Now we perform bipolar registration in O1FZ and O2FZ leads, so we can see only 2 channels of the recorded EEG on the screen. Every second, marks corresponding to the presented flashes appear on the electroencephalogram recording. Based on these labels, the analysis epochs are arranged and averaged. Now we increase the intensity of the flashes and record the evoked potentials at 20% and 50% of power. The analysis of the averaged evoked potentials clearly shows that the sensory response develops in the first 200 milliseconds, followed by a rhythmic afteractivity. Let us now compare the data obtained in different experiments. Increasing the flash intensity from 1 to 50% results in more pronounced evoked potentials. This dependence is particularly evident in the early components of the visual evoked potentials. With increasing of the flash brightness, their amplitude increases and their latency shortens. Late components are less dependent on the physical properties of the stimulus and are well detected at minimal brightness values. The second group of students will record evoked potentials to the checkerboard pattern. In the selected scenario, you can set the required square size of the checkerboard pattern and change the number of stimuli to be presented. In the Settings menu, you can change the black and white colors of the displayed squares to any other combination. Ensure that a photometric sensor is attached to the stimulation monitor. Next, check the quality of the electroencephalogram and proceed to evoked potentials recording. The presentation of visual stimuli and the recording of the EEG will begin 5 seconds after the countdown. Each change of squares from black and white to white and black is considered as a stimulus. The photosensor sends a signal that is recorded simultaneously with the electroencephalogram. The test is conducted in a darkened room. The participant is instructed to look at the fixation cross, not to be distracted, and not to look away. Already after 100 averaging in the occipital leads, visually evoked potentials are well detected and are composed of several components, 2 negative and 2 positive. A real scientist should doubt everything. That's why we and our students always do a control experiment where we average the electroencephalogram without visual stimuli.
Сейчас нужно смотреть прямо перед собой, пишем спокойно водостойно.
During this experiment, the stimulation monitor is turned away from the participant and spontaneous rhythmic activity is recorded, which, as a random process, decreases in amplitude with averaging. The more averaging, the lower the amplitude of the residual noise. This can be seen very well by combining the data from 2 experiments with visual stimulation, one with the participant looking at the monitor and one with not looking at the monitor. In the first case, we record constantly occurring evoked responses that include the four components N75, P100, N145, and P200. In the second case, the evoked responses are completely absent when the monitor is turned away. It is important to note that checkerboard and photo flash tests should be performed with caution. They involve constant rhythmic stimulation and sudden changes in brightness, which may provoke an epileptic seizure. For this reason, the tests should not be performed in cases of light sensitivity and suspected epilepsy. At the slightest sign of the participant discomfort, the stimulation should be stopped immediately. With the third group of students, we will install more electrodes and perform multi-channel recording of visual evoked potentials. This will allow us to analyze the topography of the different components. During the summer internship, most students master the technique of electrode placement and achieve low transient resistance from the first time.
Даже очень неплохо.
Ничего себе!
Очень прекрасно вообще.
Класс.
You've done a great job of installing everything. You have all the electrodes marked with green colors. The resistance values are displayed here. If everything is in order, we can click the next button. Let's go to the electroencephalogram. We can now see all the leads. You have a 19-channel recording. Now we ask our research participant to close her eyes. Yes, that's right. You can see everything very well. The green and blue colors indicate different leads from the left and right hemispheres. And in brown are the ones along the center line. As can be seen, activity in the alpha range is pronounced, and it is widely distributed over the scalp. Open your eyes, please. The beautiful Berger effect appears, and immediately oculomotor artifacts appear. To reduce the contribution of oculomotor artifacts during registration, we will have a fixation cross in the center of the screen for stimulation. Then there will be less oculomotor artifacts, but there will still be blinks. But as we have seen, we can programmatically exclude them from processing by setting an artifact selection threshold.
Мы начинаем предъявлять стимулы. Пожалуйста, зафиксируй взор на центральном крестике.
Each mark corresponds to a change of checkerboard pattern. At that moment, a signal is sent from the photosensor. You can see the white square in the corner. It coincides with each change from white to black-white. And we record these signals in the form of a vertical mark along with the EEG. When analyzing the averaged responses, it is very clear that visual evoked potentials are best pronounced in leads O1 and O2. By selecting different leads in the summary graph of evoked responses, you can see how their amplitude changes as you move from occipital to frontal leads. The early specific components of visual evoked potentials are concentrated in the area of projective visual cortex, whereas the late non-specific components have a broader topographic distribution. In addition, the latency of the late components may decrease as they move away from the occipital leads, because the sources of their generation are located in associative cortical area. These patterns are particularly well observed when the stimuli are more complicated, that is, by presenting different photographs. For this test, we will choose one of the scenarios from the Neurovisor ERP module, in which the stimuli are pictures of houses and faces. Each of these stimuli will appear briefly on the monitor for stimulation. We give no additional cognitive task and tell the participant to look at the center of the screen. The epochs for analysis are arranged in sync with the presented stimuli. Averaging is carried out for two categories of images. Evoked responses to houses are averaged separately from those to faces. In addition to the early components of VEP, several late components such as N170 and N250 can be detected in the averaged responses. The negative component N170 is a neurophysiological correlate of face perception. It is more pronounced when a human face is presented and is registered in the occipital and parietotemporal leads. The later negative component of N250 is associated with the perception of the emotional content. It also reflects the familiarity of the face. When pictures of well-known or familiar people are presented, its amplitude increases. This component has a rather broad topography and is clearly visible even in frontal leads. Thus, photoperception involves more than the detection of simple image features. It involves more complex processes related to object categorization and identification, emotion recognition, and the participant's subjective attitude toward the presented stimuli. The summer internship concludes with a student conference. This year, the conference was held on the 100th anniversary of the discovery of the electroencephalogram. The conference was attended not only by our department students and lecturers, but also by colleagues from Medical Computer Systems Company. The president of the company, Dmitry Prelutsky, gave a lecture on the development of devices for registration and analysis of electroencephalogram.
Сигнал энцефалограммы – это, наверное, один из самых наименьших по амплитуде сигналов, известных в природе. Вот именно в этом диапазоне частот, в районе от герца вот до 100, в таких частотах, в общем-то, в природе сигнала и не существует, потому что разрешение нужно микровольтовое. Микровольт – это тот предел, который по шумам, который даже современная электронная техника там еле с ним справляется, можно так сказать.
In the second part of the conference, our students gave presentations. They talked about the results they had obtained during practical tasks on registration of evoked potentials and event-related potentials. The most difficult thing for them was to answer difficult questions from the qualified audience.
Для того, чтобы провести пробу без зрительной стимуляции, с отсутствием зрительной стимуляции, мы просто отворачивали экран от испытуемого, поэтому испытуемый просто смотрел на задник монитора.
Чтобы отсутствие зрительной стимуляции ничего не удается выделить, и просто амплитуда шума становится к нулю.
В течение всего эксперимента сидел неподвижно. Все пробы мы записывали за раз.
За раз, да?
Да.
Да, но голову не фиксировали. Если бы использовали, например, лобно-поворотную.
Ну и хотя бы каждый раз переверять какую-то штуку, что он по центру.
Эндогенные события, происходящие в головном мозге, связанные с ожиданием, принятием решений или инициацией двигательного ответа.
Тут получилось хорошие данные, да, электроды надо ставить очень хорошо, и с мостопой, это я читал в одной отличной статье, кстати, это было не про ЭГ, а про вот НИРС, новый модуль, который говорили.
Компонент? Так, хорошо.
Нам надо сделать сейчас общее фото, да, в столь памятную дату. Потом мы накроем один из столов бумагой электроэнцефалографической, и будут пироги.
Today, we saw only part of the work our students are involved in during summer internship Methods of Psychophysiology. The full program can be found on the website of the Department of Higher Nervous Activity. Through all the tasks, the equipment provided by Medical Computer Systems is used. It helps us greatly and is very convenient for organizing the educational process.